call the meeting to order. I'd like to read the following public comment. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comment to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comment on or discuss or negotiate claims at this meeting. And now I would like to note that Mr. Kennedy and Dr. Waymeyer have been excused from in-person attendance for health reasons. Next, I'd like approval of the orders of the day. Can I have a motion? And a second? We have a motion and a second. All those in favor say yes. Any opposed? Motion passes. Thank you. I'm sorry.
Joe.
Didn't ask for help.
Didn't ask for an excuse.
Didn't ask for a health excuse. Yes. All right. Moving on. I'd like to move on to the approval of the minutes of the meeting of July 18, 2022. Motion, please. We have a motion and a second. All those in favor say yes.
Yes.
Hearing none, motion passes. Next, we have no board reports to be noted. And then next on the agenda is our medical staff reports. So our joint reports of the SMH Sarasota and SMH-Venice medical staffs. We have Dr. Fiorica from the Sarasota Medical Healthcare System Chief Medical Officer. Dr. Fiorica, I know that you don't have any motions for the board, but do you have anything to report?
No, I don't. Thanks.
Nothing to report? Thank you, Doctor. And next, from Sarasota Memorial Hospital, Sarasota, we have Dr. Lichtenstein, Chief of Staff. Dr. Lichtenstein, I think you do have a motion?
Yes, thank you very much, Madam Chairwoman. I would ask for a motion approving the Sarasota Memorial Hospital, Sarasota physician privileging forms for critical care medicine, emergency medicine, and otolaryngology as recommended by the SMH Sarasota Medical Executive Committee.
So we have a ask for a motion. We have a second. All those in favor say yes.
Yes.
Any opposed? Hearing none, motion passes. Thank you. Next on the agenda is Sarasota Memorial Hospital, Venice. Dr. Chris Jefferson, Chief of Staff. Dr. Jefferson, I know that you don't have any motions for the board, but do you have anything to report?
Thank you, Madam Chairwoman. I do not have a report, but I would like to thank the board for their continued support of Venice SMH.
Well, thank you, Dr. Jefferson. It was very nice. Thank you. We all appreciate that. Next, we have our secretary's report with Greg Carter, Secretary.
Thank you, Madam Chair. On Tuesday, September 6th, at 5:01 p.m., we will have our preliminary budget and village hearing. On Monday, September the 19th, at 10 a.m., we'll have our investment meeting closed session. for lunch. 2 o'clock will be the SMH Physician Services, the Personal Physicians Group annual meeting. At 3:30 will be our board meeting, and at 5:01 p.m. will be the final budget and village hearing. That is my report.
Thank you for that. Next, we have our treasurer's report. Mike Carter, secretary. Would you give us a report, please?
Of course. I move approval of bad debt and charity fair for the month ending July 31st, 2022, in the amount of $20,005,000.
Okay. We have a motion and a second. All those in favor say yes.
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 Hearing none, motion passes. Next, we have our financial highlights with William Wojcik, Chief Financial Officer. Welcome, Bill.
Thank you, Madam Chairwoman. I have financial highlights for July. We'll start with revenue in the reading format. So the system had revenue in July of $118,397,000 against a budget of $110,043,000. Fiscal year to date, this is 10 months of our fiscal year. Total revenue of $1,224.8 million compared to a budget of $1,121.1 million. Looking at total expenses for the system. Expenses in July, $115,480,000 compared to a budget of $104,168,000. Fiscal year to date, total expenses $1,100,000,000. $1 million. $2,917,000, operating margin of 2.5% compared to a budget of $5,855,000, operating margin for the July budgeted at 5.3%. Fiscal year to date, and again, this is through 10 months. Operating income of $73.6 million compared to a budget of $63 million. And we have an actual operating margin through 10 months of 6%, compared to a budget of 5.6%. Statistics for the hospitals. Average daily occupancy for the 2 hospitals, 760 patients per day, compared to a budget of 712. The Sarasota average acute stay was 4.96 days, and Venice 3.93 days.
Hey, Joe, it sounds like it's 2 o'clock.
Observation cases, and this is for 10 months, 52,516.
The meeting's underway, Daryl.
46.
2 o'clock, there we go.
This continuous statistic for the hospitals, surgery cases, 23,003, compared to 23,764. Births through 10 months, 3,571, compared to 3,711. Outpatient registrations through the fiscal year to date, 438,840, compared to a budget of 428,241. And in our 3 emergency care centers, total registrations of 123,691, compared to a budget of 118,685. And through 10 months, the case mix index at Sarasota campus for all patients 1.94, and at Sarasota campus for Medicare patients 2.04. And at Venice, all patients 1.5, which is the same as Medicare case mix index. Thank you, Madam Chair. That concludes my report.
And so next on the agenda We have our committee reports. Mission and Planning Committee, given by Mr. Greg Carter, our chair.
Thank you, Madam Chair. Commission and Planning Committee met this morning, and there were 2 presentations given to the committee, both for board approval. The first presentation was the SMH-Venice Emergency and Operating Room Services Expansion. Chair Ralph, President of SMH-Venice, began the presentation by reviewing the SMH-Venice Master Plan and current capacity constraints. Next, Sharon discussed the plan and discussed capacity constraints, which includes expanding the emergency room and operating room services. The emergency room scope includes adding 30 rooms and 1 CT scanner. The operating room scope includes completion of 2 operating rooms that were filled at the time of opening of the hospital. The expansion project will also include adding capacity to the current general energy plan, or central energy plan, as well as adding over 200 parking spaces to the campus. For the final portion of the presentation, Steve Miglietta, Chief Financial Officer of SMH-Venice, reviewed the financial data. The project is expected to complete in August 2024. At this time, I move approval of the funding for the SMH-Venice Emergency and Operating Room Services Expansion Project in an amount not to exceed $90,700,000 as recommended by the Mission and Planning Committee.
We have a motion and a second. All those in favor say yes.
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 Hearing none, motion passes.
Thank you. For the next presentation, David Barrender, President and Chief Executive Officer, and Dr. James Fiorica, Chief Medical Officer, presented the Research and Education Institute project. David introduced the project by explaining the strategic vision of the Research and Education Institute. Dr. Fiorica then reviewed the components and benefits of the Research and Education Institute. Lastly, Mr. Barrender discussed the programming and schematic design of the Institute. The Institute and an adjacent parking garage will replace the Doctors Gardens building contiguous to the south side of the SMH Sarasota. The Institute will include clinical research education, graduate medical education programs, administration, the SMH-CS board offices, and meeting rooms, a state-of-the-art simulation center, and conferencing and classroom space. The project is expected to be complete in 2025. This time, I move approval of the funding for the Research and Education Institute project in an amount not to exceed $75 million as recommended by the Mission and Planning Committee.
Second. We have a motion and a second. All those in favor, please say yes.
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 Hearing none, motion passes.
That concludes my report. Thank you.
Thank you, Mr. Carter. Next, we have our Finance Committee report given by Sarah Latch, our chair.
Thank you, Madam Chairwoman, sorry. The minutes of the joint meeting of the Finance and Audit Committees held on July 18, 2022 were approved. Next, we had Bill Wojcik, CFO, present proposals for the fiscal year operating and capital budgets. The proposed fiscal year operating budget has an operating margin of 5% and an ad valorem millage rate of 1.042 mils. The proposed fiscal year 2023 capital budget totals $299,896,000, inclusive of funds to be spent on the Cornell Family Behavioral Health Pavilion, SMH-Venice Bed Power Grade, routine capital items, and other strategic and growth projects. There was discussion, and at this time, I move approval of the recommendation of the Finance Committee of the fiscal year 2023 budget, which sets the fiscal year 2023 preliminary millage rate at 1.042, which is the same as the current millage rate. I also move confirmation that the board has set the first public hearing to adopt the proposed budget and millage rate for September 6, 2022 at 5:01 p.m. and the second public hearing to adopt the budget and millage rate for September 19th, 2022 at 5:01 p.m. Both hearings to be held in the old boardroom on the first floor of Sarasota Memorial Health Hospital System, 1700 South Canyon Trail in Sarasota.
We have a motion. Second? I can be this one. That's fine. So we have a motion and second. All those in favor, please say yes.
Yes.
Any opposed? Hearing none, motion passes.
Lastly, Bill Wojin, CFO, reported that the pricing of the $150 million Series 2022 bond issue was successfully completed last Thursday by the underwriters. Despite conditions in the bond market that were somewhat unfavorable, the underwriters did a good job of marketing the bonds at favorable rates. The bonds were sold with an average maturity of 28.5 years and an average coupon rate of 4.19%. And an all-in true interest cost for the Series 2022 will be 4.406. This is just for information and motion needed.
Thank you, Ms. Bush, for that report. Next, we have our president's report with David Banniger, our president and CEO.
Thanks, Madam Chair. I'm going to start as I do each meeting with our review of our organizational report card. And as you're well aware, we have 5 areas of focus that are on the left on the screen, followed by the goal and finally the score rating. So the first area of focus is out of service. We have a goal of having our likelihood of recommending have 8 out of 10 service areas be greater than or equal to the 75th percentile. I am happy to report that we are exceeding that at 9 out of 10, and I'll show you the details on that here in a minute. In the people area, we have our goals of having our new hire retention, which is our percentage of regular full part-time employees that are hired in FY 2022 that are still employed as of September 30th, 2022. We have a goal of that being at 83% of these individuals, and I am happy to report we're exceeding that as well at 86.37%. In the quality area focus, we have a goal of having an infection prevention, which is our combined overall standardized infection rate, being less than 0.85. Happy to report that we are exceeding that as well at 0.74. Just to give some context to that, the national average or expected rate would be 1.0, so our 0.85 is already set at a very aggressive goal. The finance area, you already heard from our CFO, Bill Wojin, but we have our goals having our operating margin be at 5.5% for the year. We are currently tracking this to be at 5.8%, so slightly above goal. And then finally, in the area of growth, we have 2 goals. One is our inpatient admissions and observation outpatients. Having the goal being that we have 60,119,000. We are tracking in excess of that as well, 62,736. And in outpatient registrations, we have a goal of having 1.125 million. And we are tracking to exceed that as well at 1.140 million. So looking a little deeper at the patient experience report card, to orient you to this report, you can see the likelihood of recommending on the left-hand side with the 10 different areas that we survey. The middle column being our actual score, the next column over being the national median score, and then finally to the far right being the 75th percentile score. As I mentioned a minute ago, I'm happy to report that 9 out of 10 areas are exceeding the 75th percentile score, meeting or exceeding. The one that's not is First Physicians Group. Their score was a 93, so 1 point off of the 75th, but all 10 areas made 15%. Next up is SMH, which means our 5-star status. Sarasota Memorial Hospital, the Sarasota campus, continues to lead the region in quality and safety as the only hospital in Sarasota, Manatee, or Charlotte counties to earn a 5-star rating for overall quality from the federal government last month. The 5-star quality rating makes Sarasota Memorial the only hospital in Florida and one of only 33 in the nation
consistently earned the Centers for Medicare and Medicaid Services highest quality award since the rating system began in 2016. Of the 4,500 plus hospitals that were evaluated, less than 14% received 5 stars, and in Florida, only 15 hospitals received that this CMS assigns the star ratings by evaluating hospital results and dozens of quality measures. Next up is our U.S. News ranks SMH as one of the best. Sarasota Memorial Hospital earned top marks in the U.S. News 2022-2023 Best Hospitals list released this past month. This year's rankings place SMH among the 50 best hospitals in America for rehab and specialized urology care. SMH also garnered high-performer ratings for a third specialty, gastroenterology and gastrointestinal surgery, as well as 15 widely performed procedures and conditions common in Medicare patients, including the list in front of you. In addition, SMH was once again earned the #1 spot in the Sarasota Bradenton North region. SMH's top IT executive is honored. I'm sure she's blushing behind me somewhere right now. Is she in here? Yeah, let's see her. Okay. Sarasota Memorial Chief Information Officer Pam Randolph is one of 11 local executives recognized in this year's CIO of the Year Awards sponsored by the Tampa Bay Business Journal. Honorees were evaluated for their innovation and strategic implementation of IT systems, leadership style, and management effectiveness, business value created from their IT operations, community involvement and philanthropy, and for their contributions to the Tampa Bay business community. Congratulations, Pam. SMH-Venice celebrates its 100th birth and inspires baby's name. Sarasota Memorial Hospital Venice welcomed the birth of its 100th baby since the new hospital opened in November 2021. Before Benjamin Anthony Morin was born on July 16th, his parents still hadn't decided on the boy's name. When they learned the baby would be the 100th baby born at SMH Venice, it helped them make their choice. Benjamin Franklin is on the $100 bill, and our baby is the 100th born in the hospital, as Mom said. I'm not making it up. Okay. The family also chose to give their son a middle name inspired by the doctor who helped bring him into the world, our OB/GYN Anthony Canino Jr. So legendary broadcaster thanks the SMH team at the 2022 ESPYs. Dave Vitale recently received the Jimmy V Award for Perseverance at the 2022 ESPY Awards. The award was given to a member of the sporting world who has overcome the greatest obstacles through perseverance and determination. In a heartfelt speech, he thanked his SMH care team, including Dr. Richard Brown, Dr. Stephen Casera, Dr. Ken Meredith, and his staff at the Brian D. Chelsea Cancer Institute. I don't know if anyone actually saw that ESPYs that night, but it was pretty wild. He stayed on the stage for well past his allotted time talking about his speech. So that's him. Our community report is available, our 2022 community update, which contains an overview of our efforts to improve access to care throughout the region while continuing the difficult fight against COVID that's being distributed throughout Sarasota County. It's also available on our website at the link that you see on the screen. Many thanks to our staff for their outstanding work. Without their dedication and support of the community, we wouldn't have such exceptional storage. Frozen treat trucks get staff a break from the heat. As part of our ongoing efforts to thank staff for all they do, we hosted a frozen treat truck parties at our hospitals for the day and evening shifts, and at several of our offsite locations a few weeks ago. Other inventory locations had their special cookie deliveries as well. And that is my report, Madam Chair. I'm happy to answer any questions.
Any questions for David? Thank you for that. Okay, moving on with our agenda. There is nothing to report on the consent agenda. And next we have our public comments. Karen, is there anyone registered? Okay, Mary Price?
Yes, thank you. So I didn't know I was going to speak to whatever was discussed. So I'm Mary Price, I live over in Arlington Park, and had to do with the research and education institute questions. So the person maybe who mentioned, and the reason I'm raising this is because we have a new behavioral health center that still has a crane that I can see from my yard. And we still have yet a new cancer institute that hasn't even broken ground. So then when, you know, I or my neighbors hear about there's yet a now research and education institute going on the same campus, which neighborhoods have been here since the 1950s, small neighborhoods, small streets and all that. That supposes why I have these questions. So you mentioned that there were discussed, which were discussed here, so I didn't know what the answers were. The first one, and I'll just list them really quickly, and then you can kind of cover them again. One, you mentioned the benefit. Secondly, the design and the schematic, which I have no idea what that is from our neighbors. The other was the parking. I have no idea how many parking spaces and where the ingress and egress are going. And since this is going to be ongoing before the neighbors hear more detail. And then the other is, how's it getting paid for? So if you want me to repeat those, I can, but if you could let me or us know what the benefits, kind of what the design scheme is, how many parking spaces, and how it's getting paid for, I appreciate it. Thank you.
Thanks, Mary. It's nice to see you, by the way. You want me to answer some of this?
Yeah.
Sure.
May you? Yes, go ahead, please.
So what I would do, Mary, is behind presentations and what's developed this morning and mission planning that covered most of this. So happy to give you a copy of that presentation. It's also on the website. We can cover it as easy as for you to get that. I think we talked about most of this at the Neighborhood Advisory Committee. So we talked about the parking garages going up behind it, that's going to have the parking in it, it's going to have the parking that moves from the other different garages to that garage. Remember, there's the parking garage that goes up behind the building, there's the Manning Alley, that's up against like the Spring Stone and us. On Arlington and Hospital. And then the design is still ongoing, but there's pictures of it in the packet is over again. So there's pictures of the architectural deal, and the paying for it is the hospital reserves and philanthropy. So we have some donors who stepped up as well. Okay.
Thank you.
I think there's a list of benefits as long as my arm, but a lot of it is around continuing to increase the education and research that goes on this campus. Education being from all walks of our staffing, from nurses to respiratory techs to surgery techs to physicians and graduate medical residents. So that's the benefit to the community to us. But it's detailed in that presentation.
Okay, thank you, Mary. I'm sure you're not on the answers. Okay, so moving on, we have our legal matters with Carol and Cambridge. All right, thank you for that. Yes, Jim?
What finally happened on the case on HCA and other steps? What was
There is no final result. The parties are doing. The question for those on the screen
is what happened with the indigent care case that the for-profit hospitals in our area brought against the county. It is in post-trial briefing right now. The trial concluded, it's in post-trial briefing, and there's been no decision because I believe that the for-profit hospitals briefing deadline was 30 days after trial, and then the defendants will have. Okay. All right, so next on our agenda is other business. Is there any other business to report? Hearing none, having completed our agenda, and we stand adjourned. Thank you, everyone.